Afternoon, everybody. My name's Dr. John Batten. I'm a Senior Fellow in Learning and Teaching and the Programme Director for Sport and Exercise Psychology here at the University of Winchester. And I'm also the kind of project lead for this collaborative project examining caregiver burden, mental health, wellbeing, sleep quality, social support and coping in the context of professional football in the UK. I'd like to acknowledge some of my other collaborators today, many of whom you've already met. So this is absolutely a collaborative project, kind of with Georgia, Matt, James, who's also on the call, as well as a couple of other people who can't join us today, but also a collaborative project with the PFA, so the Professional Footballers Association in the UK. So I know Dr. Adam White is here as well, so it's great to have him along too. In terms of my presentation, I'm actually going to take a slightly different approach to Matt and Georgia, partly because this project is a project that has just started. So I don't have any results to share with you at the moment. So instead, I'm going to talk to you a little bit about the kind of context and rationale behind this research, as well as provide a bit of an overview of the methods that we are looking to use to collect data. Okay, so in terms of some background information then, again, as Georgia's kind of already noted in her presentation, I think research generally on caregiving for someone with neurodegenerative disease following sport participation is pretty much non-existent, particularly in UK contexts. A lot of Georgia's work, which has provided some kind of really groundbreaking evidence, has actually been based in the US as well, and it'll be interesting to see kind of as this work plays out, what differences there might be in terms of cultural differences between the UK and the US. But generally speaking, we know that literature looking at other populations such as dementia clearly details the hardships involved in any caregiving role. But it is likely that former athletes with neurodegenerative disease will present some unique challenges for the caregiver. Again, Georgia mentioned earlier about symptom prevalence often beginning at a younger age. And so caregivers potentially having to support people for longer periods of time, or more likely to be involved perhaps in work themselves. So again, some quite unique challenges that we might face in this context. And I think overall what that kind of suggests is that we need to do more research to really understand the burden experienced by caregivers, kind of how this burden might impact the mental health, the well-being and sleep quality of carers, as well as any factors that might potentially moderate these impacts as well. And it's really kind of research of this nature that will help us to better understand how to support carers in such a unique environment. Unfortunately, as well, the kind of rates of concussion in sport are on the rise, and so it's probable that the incidence of caring for former athletes with neurodegenerative disease is going to increase in the future, again, kind of further highlighting the need for research in this area. In terms of some expected outcomes then from this research, so again, based on research in with other populations and also based on some of the research that Georgia and colleagues have already undertaken, I'm fully expecting the findings of this research to suggest that the burden experienced by caregivers in this context will be pretty considerable, and that this will be having quite a negative impact on their mental health, their well-being, and their sleep quality as well. In turn, I think these impacts are likely to reduce the quality of care that people are able to provide to the former players, which also has an adverse impact on their health as well. However, I guess I'm hopeful that the burden experienced by caregivers may be reduced when social support is high and that appropriate coping strategies are used, and that this can in turn kind of reduce the negative impacts on caregiver mental health, well-being and sleep quality, and hopefully improve the overall caregiving experience for both the carer and for the former player as well. As I said, this is a collaborative venture involving some of our colleagues from the PFA, so I think it's also probably worthwhile acknowledging how this research will hopefully be of benefit to football and to the PFA more generally. So I think this type of research will help us to kind of better understand the burden experienced by caregivers, kind of the impact that caregiving will have on the mental health, well-being and sleep quality of carers, as well as those factors that may potentially moderate these impacts. And in so doing, what we'll hopefully be able to do is better understand how we can support carers within this unique environment. This will hopefully allow us to look at developing interventions in the future that can support carers that serve to improve the overall caregiving experience. And then ultimately, hopefully this will direct and inform some decision making from organisations such as the PFA, who work in collaboration with various other organisations as well, to improve the care received by former players and enhancing their overall health as well. Again, I think it's also important as researchers, when we are working with different organisations, that we also acknowledge the commitment that these organisations, so in this case football, has to kind of corporate social responsibility and player welfare best practice as well. And so by working collaboratively with organisations such as the PFA on shared endeavours, hopefully we can not only make a tangible benefit to in kind of improving research quality, but actually make a direct impact on the carers and also the former players in this environment. In terms of some of the research questions that we wanted to ask, this is something that Georgia and I in particular debated for some time in terms of the direction of the relationships that we're interested in. So I think our primary research question is around wanting to examine the impact of caregiver burden on mental health, well-being and sleep quality. But the debate that we had was whether this was a linear relationship or whether this was a bi-directional relationship. And so we are going to also examine the impact of mental health, well-being and sleep quality on caregiver burden. I think the arguments, the debates, the discussions that we had here were very healthy. But the questions that we were kind of left with is, if people are experiencing high levels of burden, does that have a negative impact on their mental health, their well-being and their sleep quality? And or is it that mental health, well-being and sleep quality, when they are low, they increase the amount of burden experienced by caregivers? And so we presented this as a bit of a cyclical relationship, and it's something that we're going to look to unpack further in our analyses. At the same time, we're going to be looking at the potential moderating or mediating impact of social support and various coping strategies on these relationships as well. In terms of the study design, so this study is actually, again, slightly different to some of the works presented by Georgia and Matt, which have been more qualitatively oriented. We're actually going to be using a mixed methods approach as part of this research. So I'm aware that mixed methods research often presents some ontological and epistemological challenges, but we're hopeful that by combining both quantitative and qualitative approaches, will allow us to develop a more comprehensive understanding of this particular issue. And so what we've tried to do here is to adopt what we consider a pragmatic research philosophy, drawing on both positivist and interpretive approaches, as opposed to a single paradigm. Specifically, what we're hoping to do is to use quantitative data to examine the relationships between caregiver burden, mental health, well-being and sleep quality, as moderated by social support and coping strategies. Then use some qualitative methods to examine how caring for a former athlete with neurodegenerative disease impacts the mental health, well-being and sleep quality of the carer, as well as exactly how social support and coping strategies might impact this overall experience. In terms of participants, we've optimistically kind of hoping to recruit around 300 carers of former athletes who have been diagnosed with, are suspected of having, or who are struggling with neurodegenerative disease following their involvement in football. And these carers can include spouses, parents, children, siblings, and friends of former athletes as well. Depending on the number of responses that we get, we may look to break our analyses down into these different groups. And again, George's work earlier highlighted the differential experiences of spouses and also kind of older and younger carers as well. So that is absolutely something that we will consider, but it depends on the number of responses that we get overall. We're also hoping to conduct interviews of around about 15 participants as part of this project. In terms of our procedure, so I said we've been working collaboratively with the PFA here. So the PFA have a database of families who are actively engaged with them, and kind of work very closely with the brain health department at the PFA. So the PFA have very kindly distributed an anonymous survey This survey kind of includes various demographic questions such as age, sex and relationship to the former athlete of the carer, as well as including a number of quantitative measures of caregiver burden, mental health, well-being, sleep quality, social support and coping. At the end of the survey, participants are given the option of leaving their email address if they would like to participate in a follow-up interview to allow us to kind of better understand their experiences. And as part of that interview process, what we're interested in is understanding how their lives have changed since caregiving started, some of the emotions that they experience while caregiving and how they're able to manage those emotions, how their mental health, well-being and sleep quality has been impacted as a result of their caregiving, and also again how they're able to manage kind of any impacts on their mental health, well-being and sleep quality, both positively and any potential negative impacts, and ultimately how carers are supported by others in their role, and also how they're perceived by other people in the role, because I think perceptions from others was something that's come up a bit in previous research as well. In terms of the interview process, and again, it's a shame that Jo had to drop out today, because this is something that she would have spoken about, I'm sure, but interviewing people in this context is quite emotionally demanding, and so we've opted to have 2 interviewers involved in every single interview. One interviewer who has expertise in terms of caregiving, and one interviewer who has experience in interviewing more generally. The advantage here is that kind of these people can support one another, bounce off one another, ask kind of additional questions to hopefully increase the richness, depth and quality of the data, but also gives them an opportunity after the interviews as well to reflect, to debrief, to discuss kind of what has happened, to again hopefully help to manage some of the emotional impacts as a result of engaging in some sometimes quite difficult discussions. In terms of our quantitative measures, so we're using various different measures to assess kind of different aspects of the caregiving experience. So we've opted to use the caregiver burden inventory, which assesses 5 dimensions of caregiver burden. So this includes time dependence, developmental burden, physical burden, social burden, and emotional burden. We're using the brief COPE as a way of examining adaptive and maladaptive coping strategies that might be employed by carers of former athletes. This includes kind of 14 different coping strategies that might be used, although in terms of the analysis, we probably won't analyse all of those different coping strategies, because it's quite common in previous research to be selective in terms of which coping strategies are used in different contexts. We're going to be using the DAS9 as a way of assessing the mental health of caregivers, with a specific focus on depression, anxiety and stress. And then we're going to be using the Warwick Edinburgh Mental Wellbeing Scale as a way of assessing the mental wellbeing of caregivers of former athletes. This scale, for those of you who aren't familiar, assesses both the eudaimonic and the hedonic perspectives of mental wellbeing, as both are quite considered for important for human growth and success. We've also looked to incorporate the Jenkins Sleep Scale as a way of assessing kind of sleep problems as a proxy for subjective sleep quality. So specifically, the Jenkins Sleep Scale assesses sleep problems over the last month in relation to difficulty initiating sleep, how often people awaken during the night, difficulty that people have maintaining sleep, and also how refreshed or exhausted they are when they wake up in the morning. And then finally, we're going to be using the multidimensional scale of perceived social support to assess perceptions of social support from 3 primary sources, so family, friends, and significant others. And then finally, I think in terms of how we're proposing to analyse the data, and I'll anticipate a question from Liam here at this point, because the analysis, certainly of the quantitative data, depends largely on the number of responses that we get. So we've got options to use analyses of regression to kind of examine the relationships between mental health, wellbeing and sleep quality and caregiver burden. But depending on overall numbers in terms of quantitative responses to the survey, we might also be able to look at some kind of more complex statistical modelling, such as structural equation modelling as well. I think the interview data is going to be kind of transcribed verbatim, and then we're going to be looking to engage in some kind of thematic analysis. We'll also be looking to produce thematic maps to kind of visually represent the themes, sub-themes, and codes from that analysis as well. Again, in terms of ensuring a rigorous qualitative process, we're going to be using critical friends kind of throughout the process to challenge ideas, explore different interpretations, encourage reflection and discussion. And we're also going to be encouraging our researchers, particularly as part of the interview process, to be writing reflective memos. As I said, one of our kind of interviewers is heavily involved in caregiving, and so actually want to make sure that kind of their experiences don't shape and bias any of the interviews. So I think the reflective memos will be helpful in terms of ensuring that we've engaged in a rigorous process, but without kind of participants in certain directions. And I suspect, Matt, that's probably my 10 minutes up.